Welcome back. Well, mental health and suicide are often linked. Researchers say many cases of suicide happen among people without any mental health conditions.
A majority of boys and men who die by suicide don't have any known mental health conditions. Researchers at the CDC looked at 70,000 males across different age groups who died by suicide between 2016 and 2018. They found 60% did not have a known mental illness. Family problems were the most common stressor experienced by adolescents who died by suicide, while relationships and intimate partner problems affected young and middle-aged adults. While alcohol and substance use were not considered mental health diagnosis in the study, many of the age groups showed a significant history of problematic substance use, and about 45% of young and middle-aged adults tested positive for alcohol at the time of their death. Suicide is a leading cause of death in the United States, with an estimated one death every 11 minutes, according to the CDC. If you or someone you know needs help, call the National Suicide Prevention Lifeline at 800-273-8255 or 911.
And the American Foundation for Suicide Prevention is a national group focused on helping people who are struggling with suicidal thoughts. With local chapters across the country, Utah is fortunate enough to have one right here. And joining us today is Taryn Hiatt. She's the director for Utah. Taryn, thank you so much for joining us.
Thanks for having me.
For people who aren't familiar with the foundation, tell us a little bit on what you guys do.
Yeah, so the American Foundation for Suicide Prevention is the largest private funder of research and has been doing the bulk of work around suicide prevention for the last 30 years. So our local chapter fundraises through our Out of the Darkness Walk. That helps us to provide programs in our state for free. So we do community-based education. We advocate for policy up at the state capitol and support people who've been affected by suicide.
Tell us a little bit on what you have going on with this walk that's coming up, correct?
Yeah, so this will be our 16th annual Out of the Darkness Walk to Fight Suicide. I started the walk here in our state after we lost our dad to suicide 20 years ago. And so this is an event that just brings people together who've been affected. Whether you've lost somebody, you've struggled yourself, it's a day of hope and healing. And we actually have 7 events happening across the state, but our Salt Lake one will take place on September 10th.
Tell us a little bit about some of the misconceptions people have about mental health and maybe people who die by suicide.
Yeah, you know, a lot of times the stigma that has still surrounded suicide is thick, and people have viewed suicide as things like weakness or even selfish. I mean, those are terms that we used to hear. However, we know suicide is a health issue, and when people have untreated or poorly treated mental health conditions and they're not getting appropriate help and support, unfortunately the way one can die from a mental health condition is suicide.
So what do we do to address that? I know your foundation is doing a lot of work. What as a community can we do to help?
We invite the community to come and get educated. We offer classes all the time. Each month we host a virtual Talk Saves Lives. We're hoping to get back into our community and do them more in person. You can take a QPR class. These are all classes that teach you the warning signs of suicide, what to do when you recognize somebody is struggling, how to talk to somebody, and where to refer them to help.
And I know we only have a little bit of time, but can you tell us a couple things that people should keep in mind if they do have a loved one that they're concerned about and they're not really sure where to go from here?
So the first thing to do is talk to your person. Ask them, and ask them directly if what you're seeing or observing has them thinking of suicide. And if they say yes, refer them immediately to the National Suicide Prevention Lifeline. That just rolled out as 988. It's the new 3-digit crisis number. Again, you can talk free to somebody 24 hours a day, 7 days a week, get an assessment and see what next steps are needed. But we have to start addressing mental health the same way we do our physical health. Meaning if I'm struggling, I seek a professional. I reach out, I tell somebody. You don't have to go through this struggle alone.
How do we get people more comfortable about talking about mental health? Because I do think it's a hurdle for a lot of people.
Yeah, and we just have to practice having those conversations. You know, come out to the walks, come out and meet other people who've shared your experience. One of the things that we need to do is end the isolation that has us thinking we're all by ourselves and that no one would understand. Once we get comfortable reaching out and talking about it, then it's easier for folks to want to engage in that conversation and get help.
And Taran Hyatt, where else can people find more information on this and as well as on the walk?
Yeah, so just visit our website at afsp.org/Utah. That's where you'll find all 7 of our events happening across the state and information about how to help a loved one.
All right, Taran Hyatt, thank you so much for joining us and for all the wonderful work that you do.
Yeah, thank you.
All right.